Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody. Thanks for tuning in for Direct Connection. Just ahead tonight, we will find out how voting technology is changing for tomorrow's primary. But first tonight, the seasonal sniffles. Joining us here in the studio for this week's Your Health segment is Dr. Matthew Martinet, asthma and allergy specialist at the University of Maryland, St. Joseph Medical Center. Doctor, thank you for being with us.
Thank you, Jeff. How you doing?
Good. I knew it was allergy season because I have a black car. And when I looked at it the other day, it was coated with this sort of yellow tint.
Right.
Every year at this time.
Lack of rain helped it a little bit. It's been very busy this week.
In terms of patients?
Patients and a lot of kids and children with eye swelling and sneezing. It's been pretty crazy.
So that pollen blowing around is what you breathe in, it gets in your eyes?
Exactly. It's a formula for intense allergies when there's no rain and it's just blowing around and recirculating. It's a good day for the allergists, but sometimes not good for their patients.
Now, it bothers me a little bit of hay fever, but there are some people who are completely immune to this?
There are plenty of people who are immune to this, but there's also some people who get irritated by pollen. It's not always an allergic process. Sometimes just a sheer amount of pollen can irritate people's eyes or nose, so it's not always allergy that irritates these people.
Broad classes of allergies. I mean, it's not just hay fever. Some people it's drugs. Some people it's types of foods.
Right.
Is there a common theme?
Well, listen, allergies, you're allergic to a protein. Proteins can be drugs, including penicillin, things in the air such as pollen, venom, bee venom, and other medications. Foods, foods as well.
How good is the arsenal these days for helping somebody, specifically somebody who has what we commonly call hay fever?
Well, I mean, the arsenal's gotten expanded a little bit over the years. We still have the standard antihistamines and nasal corticosteroids that do help prevent symptoms. We have immunotherapy, which is the more advanced treatment for people who are not controlled with environmental control and with medications. That typically is the next step in controlling allergy.
You told me 40% of the people you see don't actually have allergies?
I see a lot of people come in with chronic congestion or drainage and probably chronic cough that it's a very hard thing to control. These people, we test them and they show us nothing to allergens, but bottom line, they can be treated, but it's a little bit more challenging than a straight allergic person.
What's the allergy testing process like? What I recall was you get stuck by a needle a lot.
We do it. It depends on who we're testing. If we're testing a 4-year-old, we're going to do a much more benign treatment. We're going to do a little prick test, okay? And that's going to show us basically, do they have antibody to a specific allergen? And we'll do it, depends on what their question is. Is it food allergy? We'll do it mostly for foods. If it's environmental, we'll do a little bit of both. But it really depends on why they're coming in and seeing us. Now, adults, sometimes we take it to an intradermal level. It's a little deeper underneath the skin. It's a little bit more sensitive, so it brings out a little bit more data, and then we interpret that data and we treat.
So people come in, they have a history of congestion, and they're certain, the doctor, family doctor said you got to go see the allergist.
Right. And a lot of times, like I said, they come in with different types of symptoms, drainage, dripping, congestion. Sometimes it's not the allergy. Sometimes it can be chronic sinus disease. Sometimes these people have what we call non-allergic rhinitis, which can be a big player in the allergy world.
Let's run through some of the treatments. But first, let me remind our viewers, if you have a question about asthma, allergies, or related conditions, give us a call. We'll have the number up on the screen. You can also tweet your questions. The Twitter address is @MPT News. So you mentioned the sprays. How effective are those?
Sprays are probably the most effective treatment, but the problem is you have to do this consistently. It does not work as needed. Okay, and basically what I tell people, you got to prepare for the season or prepare for the allergy. If you do not prepare, you will fail. You need to be on these things before the nose is lit up and the inflammation is out of control, because once the nose is completely shut, it's very difficult for the nasal spray to get where it needs to go.
So are you telling people you're on this stuff 12 months, or you start in February to get ready for it?
Exactly. If it's just seasonal, I'll start them at least 3 weeks before the season. I'll tell them, hey, let's get ready. let's go. Now, sometimes that's not enough, and then we have to do other things. But bottom line, you get on early, it's kind of putting out the fire before it's lit. Okay, it really does
Do you have
help.
a preference? I mean, there are prescription versions, but you can get it over the counter now.
It's like a shoe that fits. You got to find one you like. You got to find one that you are comfortable with. Some of them have alcohol in them that's a little bit more drying. Some of them are less smelly, so people like the non-scented ones as well.
Let's grab a phone call, then we'll talk about the pills. Margaret's in Baltimore County. Margaret, thank you for the call. Go ahead.
Oh, hi. My question is this. What can you do to prevent an asthma attack when you know that smoking is one of your triggers and you're stuck on an MTA disability bus of all cases with the driver that's nonstop smoking?
No kidding.
Is there anything you can do?
Yeah, I don't think that's supposed to happen, but we'll get you an answer on the air.
It's not supposed to happen, and I made complaints, but, you know, I don't want to be threatened by somebody who knows where I live. So I'm just wondering, what can I do to help myself in that kind of situation? Because the last time I was sick for 2 weeks.
Yeah, we'll get you an answer. Margaret, good luck. Thank you.
Well, that's a difficult one. I mean, obviously, avoidance is the number one with that, and I would maybe call the authorities or whoever is in charge and make sure that
Anonymous tip.
Exactly right. You can pre-treat asthma. We can get you on inhalers that will probably give you some leeway or a little bit of buffer. But if you're that sensitive to tobacco smoke, it would be very difficult.
All right. On the hay fever treatment. The antihistamines have been around forever. When I was a kid, it was these little yellow pills. That,
chlorotrimazole.
Yeah, and they put you to sleep, but they help with the... And then there's the next generation, which is a little bit better. Is that where we are now?
Well, listen, I mean, my whole thing is that, we want to gear it to some people are more sensitive to others. Some people can take cetirizine, which is a little bit more drying, that's generic Zyrtec. And some people, Allegra is the selling point, it makes nobody tired, even at 3 times the dosing. So basically,
it's not supposed to work all that well either.
Well, it works pretty well, but listen, sometimes, unfortunately, we have to combine things, okay? Sometimes I'll pick one that's a little less sedating during the day and maybe a little something at night if they have breakthrough. We sometimes have to give them a way to manage because one pill might not be enough. Sometimes people need more. Okay.
Does that stuff help with people that have eye symptoms? Itchy, watery eyes.
I mean, antihistamines strictly help for the irritative symptoms: sneezing, runny nose, itchy eyes, postnasal drip. Now, some of the older antihistamines are actually better for drainage because they have what we call anticholinergic effects. They dry things up. Whereas Allegra is a newer one that doesn't make anybody tired, preferred by the FAA for flying, but it doesn't dry as much. So it does help for the itchy sneezes, but not the drainage and dripping.
Interesting. The FAA doesn't want you flying on Zyrtec?
Yeah, no.
Really?
No.
All right.
Yeah.
George in Anne Arundel County. George, thanks for the call. Go ahead.
Thank you.
You bet.
I was wondering if medical science has determined what the root cause of allergies is. Is it all genetic? And why do some people, some children, have it early and then, quote, outgrow it, unquote, and then other people will be okay as children and then develop it when they get into their 30s or 40s?
Wow, bunch of good questions. George, thank you very much.
That's a great question. There is been no specific gene has identified the allergy. It's related to be multifactorial in a bunch of different genes. So we're not exactly sure why that happens. I can say most of this is genetic, and 90% of children who have both parents who are allergic will have allergies in some type. It might be mild or moderate. If one parent's allergic, 50% of those children will most likely develop some type of environmental allergies. But we don't know why it expresses itself. We often think that maybe it's the exposure in early childhood to either a cat or dog. Sometimes people will get desensitized, or they'll have less allergies, or sometimes they can have more. It really goes both ways, and there's no great studies that prove that.
A couple of Twitter questions. Any long-term effects of using loratadine? Is that something?
That's
close enough.
Generic Claritin.
Using that long-term.
Honestly, and I've done the studies, there really is no long-term issue with any antihistamine. The short-term issue, if you use too much, could be dry mouth and tiredness. But in general, there's been antihistamines created in the 1940s. We've had no issues long-term ever proven. So these things are very safe in general.
What if you have to work outdoors? Well, you're somebody who's got a problem with this.
Yeah.
You see people walking around with looks like surgical masks.
Right.
I mean, would that help at all?
That does help. I mean, barriers do help. I mean, obviously jumping, in the shower right when you get out of the muck, because a lot of times we don't Now, if I play golf on Sunday morning, it's not usually Sunday morning that I'm hurting. It's usually Sunday night or Monday is when I pay for it. So getting out of the junk, washing off, jumping in the shower, a little saline rinse, that can definitely help us as well.
One of our producers was interested in the neti pot.
Right.
For people who haven't heard of this, it's like it looks like you know, the I Dream of Jeannie thing. And somehow you tilt over and you pour a pot full of water up your nose, and to flush things out. Do you have patients who have good results?
I have many patients who like the neti pot. Other people like the squeeze bottle. Some people like the simply saline. Again, you got to find a shoe that fits for you. Some people cannot take that much debris or much liquid going into their nasal passages, and sometimes it can feel cloggy in the ears. You just got to be a little careful.
So that's not a myth. I mean, it looks like a gimmick, but
it does two things. Yeah. It gets allergens out of your nose, and it also kind of almost like flossing and brushing the teeth. It kind of vitalizes the tissue, gets a little bit healthier. So it does help.
What's your advice for somebody who just doesn't want to mess with it? I mean, sort of suffer through this time of year. You know, they don't want to be on the drugs. I mean, you're just hurting yourself. There's no reason to suffer. There's ways we can get you. If I can get you 50% better, that's almost 1,000% better for a lot of people. And you're talking about stuff without terrible side effects.
Exactly. Yeah. I mean, as long as it's explained, I tell them how to work it and things. Typically, people get by and they feel better. I'm not saying they feel perfect all the time.
Let's take another call. Charles County. This is Bob. Bob, thanks for the call. Go ahead.
Yes, sir. Yeah, I had asthma when I was a child. I was allergic to dust, and they say that sometimes as you get older, it disappeared, but as you get older, it comes back. Like 30, 40 years later, it can reoccur. Is that true?
Great question. Thanks.
Good question. You know, it's unpredictable. That's why I see all age groups. It can come back, but I'd say for the most part, childhood asthma that goes away typically stays away from what I see. Now, when you get older, we find more drainage issues, dripping, congestion. We see that a little bit more. But asthma typically stays away. I can say that. And if it comes back, it's usually fairly easily treated.
Patricia in Carroll County. Patricia, thank you for calling. Go ahead.
Yes, I was wondering, I don't know if you've addressed this or not, but eye allergies where your eyes drain more than anything and they itch pretty constantly and the old tea bag remedy doesn't work. Is there anything in particular for that?
You ever been tested? Can I ask?
Yes.
Okay, so you know what you're allergic to?
Yes.
Okay, thanks very much.
Well, I mean, listen, I mean, it's if you're allergic to tree pollen, it's obviously trying to avoid peak tree pollen hours, wearing sunglasses outside. These are things that might help. Probably not as much as you'd like. There are eye drops that stabilize the mast cells or antihistamine eye drops to help. Sometimes it's bad enough we have to put people on a couple, a week or so of oral steroid drops so they don't gouge their eyes out. But I mean, overall, if it's severe, we talk about further treatments, desensitizing and things like that. Understanding also that a lot of the running of the eyes, part of allergy eye is dry eye. And once you start rubbing, the eyes get dry and they start to weep, okay? Sometimes adding a little wetting solution also to the allergy eye drop is effective and a good antihistamine regimen. They've also shown that certain nasal sprays also, for some reason, we're not sure exactly why, do help ocular symptoms as well. So being on a good regimen definitely should help your eyes.
We have to leave it there. I should have asked, is Dr. Martinet?
Yes.
All right, Dr. Matthew Martinet of the University of Maryland St. Joseph Medical Center. Thanks for coming by.
Appreciate it.
Appreciate it. Now, as part of MPT's Chesapeake Bay Week tonight, the spotlight is on the Conowingo Dam. Here's a sneak peek.
On a bitterly cold November day in 1927, everyone knew there was no going back. The future had arrived, and it came with a bang. Here in the splashing shallows of the mighty Susquehanna, that promise rose from the slippery river bedrock. The builders called it Conowingo, native for at the rapids. In the day, it was considered new and miraculous engineering that changed the lives of people both near and far. From the men who built it,
you look at it, the manpower, every crew was 50 men.
To those who sacrificed for it.
This poor guy died working on the Conowingo Dam, and they didn't even put his name in the article.
Even an entire town that vanished because of it.
You expect that town to last forever.
Raging floodwaters tested it.
Flood bulletin from the U.S.
And a storm of the century threatened it.
Severe local flooding and near disaster conditions are developing locally.
The force of that water, and it kept coming up, coming up, coming up.
They were going to have to do something to let the water get out.
Living in Port Deposit, my fear was it wiped everything out.
From its unique outer beauty, the complexity of its hidden tunnels, hatches, and valves, to why it remains vital today. This is the story of a river, those who lived on it, and the hydroelectric power dam that changed everything.
That looks terrific. So tune in tonight at 9 o'clock for Conowingo Dam, Power on the Susquehanna. It's part of MPT's Chesapeake Bay Week. Well, tomorrow is primary election day in Maryland. As people who voted early know, the old touchscreen system is no more. Joining us now is Armstead Jones, election director for Baltimore City. Thanks for being with us.
Thanks, Jeff, for having me.
So this is back to the future. We're using paper ballots again, right?
Well, Baltimore City basically, as an election system, has basically never used a paper ballot. Some of the other surrounding counties have had paper ballots in the last 15, 20 years, even maybe the end of the 90s.
You used to have the machine where you went in and you pulled the
lever.
lever. Right.
Yes, yes. So I know back to the 40s, we basically had some type of mechanical machine here in Baltimore. But we will be using paper. We did that in early voting, and the voters seemed very happy with the process.
How simple is it? Is it a matter of just checking a box?
Well, no, you can't check, you can't X. You need to bubble in the oval completely.
This is taking me back to high school. Do they give you number 2 pencils? And it's a Scantron kind of thing?
Yes. Once you finish marking the ballot, then it goes into an optical scan, and it's read and drops down into the bottom of the bin.
So what could go wrong? Somebody could half fill in a bubble?
Well, they could half fill it in, they could check it, exit, overvote. And of course, the machine will let you know if you overvoted and give you an opportunity to go back and get another ballot, spoil that one.
So overvote is you voted for both Bush and Gore on the same ballot.
Yeah, so
both
if it says, if it says vote for 2 and you vote for 3 in that race, that's an overvote.
Okay. But the machine that before you leave, you feed it into a machine.
Yes, an optical scan.
And if you did anything horribly bad, it'll kick it back.
It will kick it back, or it will say to you, if you've overvoted, do you still want to cast the ballot? You still can have that option. And you can do that or take it back, and the judge will issue you another one.
What was the experience in early voting? How did it go?
It went real well. The first day of early voting, of course, with new system, there were a few glitches among our judges and even with voters. Once those issues were ironed out, things sailed on through for the next 7 days.
What kind of issues? Anything you'd want people to know about before primary day tomorrow?
Well, again, basically following the directions, or don't check, don't X, bubble it in completely. Read to find out how many persons you're allowed to vote for in that particular race.
Let me remind our viewers, if you have a question about the new voting technology, give us a call. We'll have the number on the screen. You could also tweet a question. The Twitter address is @MPT News. What does this mean for counting the votes on election night?
Well, basically what happens, we have a memory stick in the optical scan. So that still will be read electronically through a computer and updated, and we'll get the numbers that way. The ballots basically will only be read in case of a challenge or any contested race.
What time tomorrow night do we know who the winner of the big Democratic primary for mayor is?
Well, most of the time, not unless it's clear cut, On election night, we have maybe by 11 o'clock, most of the numbers are in, but then you still have absentee ballots that still have to be counted, so it depends on how close those numbers are.
Yeah. Talk about the turnout for early voting. It was off the charts.
Oh, yeah. We had at least 31,000 in Baltimore City alone, and statewide, they did great as well. The voters came out, and they came and voted, and they were very impressed with the system.
I remember your predecessor, Barbara Jackson, always made an official forecast of what the turnout was going to be. Do you want to go out on a ledge?
Well, you know, I've been debating numbers. I think we'll have a high turnout. First time for a presidential and mayoral race together. That's what makes it sort of difficulty. Yeah, it makes it a little difficult to put some numbers together. But I think with the high numbers in early voting, I look to see at least 40-some% come out.
So the decision to switch to the new technology, I mean, one of the reasons to do it was it's a lot simpler than everybody having a separate computer, I guess. Well, and the second thing is that there's an actual paper trail if there needs to be a recount at some point.
Right, and the legislature decided to do the paper trail. You know, at one time, a lot of voters said, I want a receipt at the end to make sure that the mechanical electronic machine voted the way I voted. So you don't have a receipt, but you do have a paper trail now in the paper ballot.
Yeah, people were always a little skeptical of the machine with the levers. They were really skeptical of the computers because you never heard anything click and you couldn't see an actual piece of evidence.
Right, I guess that's true. I think the system worked fine, pretty accurate. And of course, that's the era that we're in now, technology. But the paper does give a paper trail.
Yeah, so you have a mix of both.
You have, a little of both.
Let's grab a phone call. George in Howard County. George, thank you for calling. Go ahead.
If it says vote for no more than 3 and you vote for 4, what happens to your vote?
Thank you, sir.
What happens, the optical scan will come, the screen will come up and tell you that you've overvoted, and gives you an opportunity to either cast it as it is, or it will reject it and kick it out, and that gives you an opportunity to give it to the judge, and she will issue you a new ballot.
But if you go and vote as is, and you voted for 4 and it said vote for 3,
nothing in that race counts.
Got it. Back to Howard County, Marilyn joining us. Marilyn, thank you for the call. Go ahead.
Oh, yes. I applied for an absentee ballot, and I hadn't received it as of today. How late can we vote if it doesn't come till tomorrow or Wednesday or even later?
Thank you very much. I mean, tomorrow is the deadline.
Yeah, what I would probably suggest at this late date, and of course that is in Howard County, not Baltimore City, but works the same all over the state. What I would perhaps do at this point is go to the local board of elections there in Howard County and let them know that you had applied for an absentee ballot and you had not received it, and to go there and they will allow you to vote there and issue you a new one. And when that other one does show up, they'll be able to tell if you voted twice.
The absentee deadline is passed already in terms of asking for an absentee ballot.
By mail or by fax, yes. You can walk in and get one and vote it there at the local board. And if you want to serve as an agent for someone, you have to get the form, fill it out, have that person to sign it. You can bring it to the local board. They will issue you the ballot in an envelope. You take it to the voter, then you can bring it back before 8 p.m. tomorrow night.
Before we go, just a few seconds, very good Twitter question. How will this affect the time somebody spends in the voting booth?
Well, you know, I try to encourage the voters to be prepared. I use a little slogan, a prepared voter is a good voter. If you prepare, know the candidates, know the issues before you come. You also get what we call a specimen ballot in the mail, and it looks the same as your ballot. You can mark that document and bring it into the polling place with you and just transfer the information right over.
Well, it's going to be a busy Tuesday and a late night for Armstead Jones of the Baltimore City Board of Elections. So thank you for coming by.
Thanks, Jeff.
Appreciate it. Thank you for joining us for Direct Connection. We're back Thursday with your money and business. Have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.